So welcome to the next episode of the Working Wellbeings podcast. I'm delighted to be joined by Chris van Stolk from Rand, who's on the line. Hey, Chris.
Hi there, Matt. Good to be here.
Yeah, and this is the third time trying to speak to you. I shouldn't say this on the recording, should I? But it was my fault. I've been ill a couple of times before, so I'm really looking forward to today's conversation because it's almost like third time at the trying.
No, it's good to be having this conversation, Matt, and also at a good time. I think a lot of things are changing in the work in the being space.
Ooh, well, maybe we can get onto that. So before we do, for the purpose of our listeners, would you like to introduce yourselves, tell me a little bit more about who you are, and tell me a bit more about Rand as well?
Yeah. So I'm Chris van Stolk. I'm a senior researcher at RAND. We're an independent research organization based in Cambridge in the UK. I've been working in this space for about 17 years, maybe 2 decades. I'm working really to bring an evidence base to the workplace well-being sort of area. So a lot of research studies, a lot of data analysis, working with both public sector as well as private sector bodies. And I'm probably quite well known over the years from my involvement with Britain's Healthiest Workplace, my involvement with improving the health and well-being of NHS staff. So I've taken on a few sort of meaty subjects along the way.
And I'm going to ask you a little bit about you. We both attended the Health and Wellbeing at Work conference a couple of weeks ago, although we weren't able to meet at the time. But I wanted to ask you a little bit about that. But before we do, you mentioned that you've worked in this space for 17 years, long old time. What have you seen? This is a big question, but what's changed? What's different now than 17 years ago?
Well, I think on the one hand, the challenge has become greater, and we haven't become healthier as a population and also as workers. So in some ways, the challenges that we face in terms of workplace health and well-being have become greater, and some of that's driven by poor mental health. Some of it is driven by population aging, and some of it we can't really explain. So that's also an interesting sort of observation. But on the other hand, and the more positive side is that the evidence base around what works in terms of improving workplace health and well-being is also improving. So we know better what to do, what works, and also we know better what not to do. So I think we have better answers. But on the other hand, over the 17 years that I've been involved, the problem has also gotten worse in terms of poor health and well-being in general across our population.
So that's the paradox, right? That we've got all these potential solutions, and the whole wellness industry has absolutely boomed in the last couple of decades. But as you say, many different markers, if you look at depression, anxiety, and workplace stress, seem to be moving in the other direction. Is there a way that we can explain that?
Yeah, I think there are certain societal trends, and workplaces cannot escape from that. I mean, I think if you look at anxiety and depression across our society, that has gotten worse. The workplace, of course, is not exempt from that. So we're importing a lot of these things, societal issues, into the workplace. You could also look at the challenges that the NHS faces to some extent. The challenges that we have in other areas around financial resilience. So there's no shortage of challenges. So in a sense, is what is happening in society also, of course, has a direct influence on what happens in the workplace. So I think those two are so closely interlinked. So you can't really separate them out. So I think that's broadly what's going on. And of course, we also have to keep in mind that we're an aging population. Our fertility rates are really low. And so we're asking people to work longer. Who traditionally might have retired earlier, and that of course brings with it a certain level of chronic conditions as well that we see within our workplaces. So there's a lot of interesting dynamics there.
Yeah, that is interesting. And you're talking there about the link between societal impacts on the workplace. And that leads me to the question around responsibility in terms of where you think the responsibility for some of this stuff lies. So where do you feel that sits? Do you think that that's governments should be taking the lead on this sort of thing to improve things on a societal level? Is it individuals themselves? Is it workplaces and senior leaders within them, or all of the above? What do you think?
I think it's all of the above, man. So, I mean, that's not a surprising answer, perhaps, but the UK has a slightly odd system, I think, and probably quite odd compared to some of the Nordic countries that we have around us. By those, I mean the Scandinavian countries, maybe in my home country, the Netherlands. In a sense, is that the concept of shared responsibility in this space doesn't really exist in the same way that it exists in those countries. And let me explain that. I think there's a certain point to which an employer is responsible for the health and well-being of their employee, together with the employee. And when that stops, then all of a sudden the state steps in and takes over full responsibility, through the benefit system, through the NHS, etc. And that's very different in other countries where that shared responsibility remains for much longer. So probably for the first year of an illness, you probably have a shared responsibility between the employer, employee. Insurance, of course, in those countries comes into play as well. And of course, the state. So there's a much more interplay and much more intensive support available for an employee who might be struggling with health and well-being issues. And we don't quite have that system in the UK, and that creates all kinds of problems.
So you're suggesting that the Nordic countries have got a better system? Is it solved over there, or is it just a different set of challenges?
No, it's not a problem necessarily that you can solve. I mean, I think you obviously sort of poor health and well-being in the workplace is a challenge for everyone, every country, simply because many European countries have aging populations, but the way it's managed is different. And I would argue that it's also managed in a more effective manner compared to the UK. So we have a huge problem here in the UK with people falling out of work and not being able to get it back into work because of ill health. We have a huge issue around economic inactivity, which other countries have as well, but not to the same extent. So it's then, you need to start reflecting on why that is. And I would argue that some of the reasons I mentioned is probably why that is the case.
Yeah, super interesting. Even on a more micro level, I was having a conversation just this morning with a wellbeing leader from a relatively large organization, and she was talking about this phenomenon that I've come across before of almost individuals falling through the gaps between, so if they're exhibiting some sort of mental health problem or even just stress in the workplace, where do they go? Do they go to their line manager, and should that person have responsibility, they'll quickly pass it on to HR, who will then quickly pass it on to the employee assistance program? Or no, you just need to go and see your GP because you've mentioned the dreaded, mental health word, so we can't deal with that. And it's, if the way we were describing it almost felt like a little bit of a hot potato, who holds this, rather than, as I think you're suggesting there, could we take a more integrated approach to just support that individual? Because that's the most important thing, right?
I think that's absolutely right, Matt. And of course, there's some really good evidence that once a person like that gets referred into the health system, there's some good evidence to suggest that GP will sign them off sick for an extended period of time. And because they are signed off sick for an extended period of time, they're less likely to come back to work. They are more likely to get into the benefit system. If they get into the benefit system and they stay in the benefit system for 6 months, they're almost not, it's very improbable that they will come back to work after that. So we're almost creating this kind of doom loop, which is a real problem, and we need to snap out of it, because of course the other reality is that we cannot afford it any longer. As we age as a population, our public finances are getting more stretched, so we need to kind of keep people in work. We need to make sure that they're productive, that they're well, and we cannot afford the whole rafts of our population being economically inactive. So it's an imperative that we get this right, and this is not just from the government's point of view, but it's also from employers who of course want to retain their staff, and they want to have productive staff, and that we know that leads to better business outcomes. It's also better for the employee, because quite frankly, if you have a purpose in life and if you're working, you're more likely to be have better well-being as well, and have a more fulfilled life. So I think on all of these levels we need to get this right.
Well, why aren't people doing it? Why aren't people doing it? So I've probably worked in this field not quite a similar length, but over a decade, and been to conferences like the Health and Wellbeing at Work conference over 10 years ago, and people stood in the stand saying, right, there's going to be a tipping point. There's going to be a moment where suddenly senior leaders get it, individuals take ownership of their own well-being, and so on and so forth. Governments start taking this stuff really seriously. And of course, there's been positive steps, as we've discussed already, over the last 10 years. But I've not reached this magic tipping point that I think I was looking for. That might just be a fictional tipping point that would never exist. But what's stopping us, reaching something like that?
Well, I think there is multiple factors, of course, in play, Matt. As always, it's not there's not a single answer to this question. But ultimately, I think where it often goes wrong is that we have a plethora of government initiatives. Many of them get reversed and maybe not fully implemented. Signals that are given to employers and employees alike get sort of muddled along the way. I always say, like, we have for instance, a research and development tax incentive. Why is there not a tax incentive to, around human capital, in terms of harnessing our human capital better? So for instance, when I was doing Britain's Healthiest Workplace, we calculated that every single employee would lose on average about 40 working days due to ill health, be it absenteeism or presenteeism. So not being well while at work. So it's about 40 days per employee, per employer. So I mean, it's quite a very significant number. So you could almost do it like the tax year, so somebody starts working for you somewhere towards the end of February, beginning of March, right? So if you had an IT system that would function along those lines, would you tolerate that in a business? Clearly not, right? It would be uproar, and everybody would be trying to manage this. You might fire the IT manager or whatever it is. But still, we are quite happy to run our human capital in this way, which I find quite astonishing. And I think in terms of the government, the signals that it gives, clearly, I mean, it is incredibly important, but they are, very unlikely to give an incentive to employers to get this right. So this could be a tax incentive, could be grants, etc. There's plenty of guidance out there, but we also know that it's, that it's difficult to follow this guidance. I think many employers understand the business case for this now. And I think especially the large employers in the UK, there's a huge change that's happening. And you will have seen this, Matt, in the work that you've been doing. However, is this also the case in SMEs and small employers who sort of live hand to mouth, month to month? Can they really make these kind of investments that we're asking them to make? In terms of the ecosystem as well, in terms of, that interplay that I mentioned between, insurance and so on, where does insurance come in? How about your income protection insurance, your health insurance? Where does that come into play and so on? And again, not every employer will offer some of those options. So there is a huge sort of different aspects of the system that have to work together for this to be right. Well, I would also argue, finally, in terms of the public sector, that we also have very high disability benefits compared to the continent. So, I mean, you do have I don't want to belittle anybody's disability or mental health condition. There are very serious conditions out there, but these are very relatively high benefits. So obviously, you have an incentive to be on those benefits compared to, for instance, job seekers allowance. So there's all kinds of aspects of the system that do not work together, and that makes it difficult to get this right holistically, if that makes sense.
But hopefully not impossible. Have we got people like you working on it, Chris?
Never.
So on that, one of the things that you mentioned there links me onto a question that I wanted to ask about like I say, you spoke at the conference and you were involved with lots of different sessions. God, they really got their pound of flesh out of you there. I think it was 4 or 5 different sessions that you were on. There was one title of, I think it was a keynote that you ran that really caught my eye: work as a health outcome. Can you tell me a little bit more about that?
Yeah, and I'm glad you raised that, Matt, because I think it is really, really important. And you're right; they worked me really hard at the conference. So you always read the fine print when you volunteer, But in terms of that particular session, work as a health outcome, it's simple as the fact that we know that good work is good for individuals and it's actually supportive of their health, and we intrinsically know this. But having the evidence around that is really, really powerful. But it's also the case that if you're looking at the health system, for instance, the NHS, how many practitioners in that health system, such as doctors, nurses, consultants, see work as a health outcome, see as work as something really fundamentally important? I'm married to a doctor. I know that she's very focused on improving the health of her patients, and that's her main sort of preoccupation. It's very rare that you would look at the social circumstances of this individual, look at the work situation of this individual, and maybe some of her actions are not supportive of keeping this individual into work. So it's really how we can get a system working in a sense of actually consider wider social outcomes. And that's, of course, really difficult when you have a health system that is under so much pressure. And vice versa, of course, we've also been working significantly with organizations like DWP, Department for Work and Pensions, for them to actually take health outcomes seriously. So how does a system sort of start thinking about Matt as a person, right? You might go with certain stress complaints into to see a medical practitioner, and this medical practitioner is saying, well, looks to me like Matt is having stress at work, and how can we resolve this holistically? Rather than saying, well, I think we might need to put Matt on antidepressants and take him out of work for a long period of time, which will probably undermine your well-being and might make your depression worse. So these things. So we intrinsically know that this is the right thing. However, in practice, it's not happening, if that makes sense. And then how can you make it happen? And so that's sort of the sort of thinking along those lines. So keep in mind, some of that thinking is 20 years old. So it goes back to the question you asked me up front, how much progress we've been making in some of these areas. In some areas more than others, I would argue.
Yeah, it's interesting because when you started telling me about that, my mind immediately goes to the work of Dane Carroll Black, which, like you say, which I'm sure you're aware of, which is must be over a decade old now, and the shift from things from sick notes to fit notes, right? And that shift that was made a number of years ago doesn't seem to, as we've talked about, necessarily had the impact we'd like it to have had, although it was on the right lines, right?
Yeah, and I think if you had Carol in the studio today, she would argue exactly the same thing. She said that didn't produce the shift that was required. So the business case is not only something you need to make for government, but you also, or the treasury for that matter, but you also need to make it for employers, right? I mean, and I think that's where we made much more significant headway, because ultimately, if employers start thinking about the health and well-being of their employees being more central to achieving good business outcomes, by definition, they will also invest more into it and be much more supportive of that in the workplace. And we see that shift happening, for no doubt. And so that's on the one hand, a really positive development. But of course, we need to see that better interplay between different systems, between insurers and employers and the government.
That convincing organizations that it matters, again, that's something. Why has that not happened already? I know the evidence isn't quite as strong as we would have liked it to be, but there's certainly some really, really convincing, compelling new research, right? That shows just how important well-being, health is for the performance of an organization. I feel like we've got a negativity bias, though. I feel like we need to see a couple of organizations really suffer because they don't take this stuff seriously and see themselves as a competitive disadvantage. I don't know.
But I would argue, Matt, that the evidence base is really strong. I mean, we looked at health and well-being of practitioners and nurses in the NHS, and what you saw, of course, in those nations, NHS organizations where they had better staff health and well-being, and you could look at an individual level, they also had better outcomes, and that was quite wide-ranging: mortality, infection rates, all of these different things, financial performance in some cases. Of course, the causal direction is not always clear. You could say, well, maybe they're working in better organizations to begin with, and that's a fair criticism. But from the financial sector, there are some really interesting studies. I mean, we always think about finance, big banks, and so on. If you pay somebody, they will perform better and what have you. But actually, what's really interesting is that the health and well-being of people is a main driver for performance. And so, for instance, we looked with a very large finance firm, looking at, for instance, the link between health and well-being of staff and rogue behavior, so people not complying. And if you think about an organization like that, compliance can be very costly. Lack of compliance can be very costly, right? Can you imagine if you get in trouble with the regulator, you get fined and all that sort of stuff? So there was a really strong link between people's health and well-being and more compliant behavior, sort of better behavior within the workplace. And so that all kinds of things that we know about. So I think some of these things are relatively mainstream, but you're right. I think we need to keep making the business case at all levels, be it at chief executive level, finance director level, HR level, line manager level. It's a continuous process for sure. But I think that the tide is turning. So I'm very positive on that score.
Yeah. And I've got another kind of paradox I just thought I'd run by you because I've been kind of twisting it around in my head for a few months now, probably. In terms of, the changing generations and their expectations of work and this sort of thing. And the paradox being that absolutely, cost of living crisis is real. Financial insecurity for people is a source of stress. However, there is another side to the fact that inflation's gone crazy and people can't afford homes and all the rest of it, is that perhaps financial incentives actually, in a weird kind of way, move down individuals' motivations, move down in terms of an individual's motivation to get a job, for example. So I'll give you an example. So I spoke to a recruiter about a year ago. They were recruiting for a job in the city. I think it was a law firm, and they couldn't get anyone, right? Because essentially people knew that this organization was a really hard place to work, and you were probably going to get burnt out, and it was not going to be good for your health. And despite the fact that they had quite a high salary that they were offering, they couldn't get people in through the door. They spoke to this law firm, and the law firm said, well, put another 15, 20 grand on the salary, please, and offer them more. They did it, and they still couldn't get anybody. And I just wondered whether that was a weird kind of shifting in terms of what people are looking for when they're applying for these roles. It's not just salary. It's because almost it doesn't matter how, if I'm getting paid £10,000 more, I still can't afford a house because I live in London. So what I'd rather have is not be able to afford a house, but be well.
Well, I'm glad you raised that point, Matt, because there's a lot of literature around, sort of financial reward and exactly the point you're making. Just because, you offer somebody a bonus, you might not mean that, you might get them to perform for you or actually in this case, join the firm. And so this is always a bit of a fallacy in terms of how perhaps, our employers in the city have thought about this. As long as you pay people, they will perform better for you. There's really very little evidence to suggest that that's the case. Team-based incentives work really well from that point of view. But I'm not going to go into the whole incentive literature and so on, because that will take us, certainly a few more podcasts to analyze that. But I think you're right. I think people are looking for more purpose at work, for sure. They're looking for better work-life balance. What's really interesting about this generation, and I should be a bit cautious in terms of saying this, because certainly being from a certain generation, everybody tends to sort of complain about the younger generation. I think this goes back to old Greek times. I think Socrates was complaining about, fecal youngsters in Athens, I think, back in the days. So I think everybody does this to some extent. But there are some really, really interesting trends nonetheless. I think, 1 in 8 of our youngsters are not in education, employment, or work. And 1 in 8, that's quite very significant. Many more of our youngsters work part-time. It's not something that we've ever seen before. Our younger workers, 18 to 25, are also the largest growing group, which is slightly worrying in terms of those persons becoming economically inactive. Year on year. So there is something happening, which is kind of problematic, which we need to think about in terms of how we manage our workforce. The other thing that I would note is that this is a kind of a scarce commodity, youngsters. Not only are we aging, and sorry, that's I have some bad news there, Matt. That's inevitable. But
after 2 kids, I definitely feel it.
Well, I have 3, so I can relate to that. So in terms of aging, but the other thing is, of course, our fertility rate is really, really low. And so it's dropped from 1.8 to 1.4. That's very significant. So we have fewer youngsters. We'll be closing down schools in the next 5 years just because of this issue. That also means that these younger workers are becoming more scarce. They have different working patterns. So really integrating them into the workplace will be really fundamentally important. And of course, those trade-offs that you just mentioned, pay will not solve this issue. This will be about providing, a better experience for those individuals, a workplace that's supportive of their health and well-being, but also of their aspirations, where they have a purpose. So I think we need to look at all of those things. I remember talking to a large consultancy, and they said at board level, and they said, we believe that the generation coming into working for us now, is the first generation that does not share the objectives of this boardroom. They were making money for partners, right? This consultancy firm, and that generation was more interested in social purpose, volunteering, wider things that were happening that they felt should be happening in a workplace. So fascinating. I thought that was a really fascinating discussion.
That is fascinating. There's the clip for social media sorted right there. I love that. I love that as an example. Look, just before we've only got about 5 minutes left, but just before we finish, I was going to ask you about the continuation of that in terms of key trends in the future. I know that was a conversation that you were involved with at the conference, right? In terms of some of those key trends. In addition to what we've spoken about already, was there anything else that came out of that?
Yeah, I think that was my session, Matt. So I mean, that was they were working me really hard. Not only did I chair that session, but I spoke at it as well. But I think one of the key trends, obviously, to talk about is what's happening with young people. And so I've explained that already. But the other aspect, of course, really critically important as well, is economic inactivity. It's really the elephant in the room. How many people in our workplace are economically inactive, and how we manage that as a society in terms of that stock. And there's multiple different issues there. Of course, employers need individuals, new employees to join them in terms of actually getting the business business outcomes that they want to achieve, but also grow. Of course, and economic growth is a fundamental challenge in our society, and of course, labor has made that one of their key central policy priorities. So that is absolutely important. But of course, on the other side, the flip side of it is, as a society, and again, thinking about our aging population, we cannot afford to have this many people sitting on the sidelines. And so then what do you do in that dimension going forward? And so I think this will be a real fundamental challenge, I think, for us as a society in terms of getting this right. So if I was an employer and sort of putting myself in their shoes, is what, if you're thinking about growing your business, what would you do in terms of human capital management, both in terms of bringing people on board, retaining them, training them, supporting them through health and well-being to sort of make this work and so on. And I would probably at this point in time would double down on some of the things that we know that work, sort of around health and well-being, because that's will be, of course, of critical importance, and also will probably explain. And you mentioned this earlier, whether certain businesses are successful or certain employers are successful or less successful, or maybe disappear. I think it's that fundamental.
Yeah, absolutely. I agree. Look, it would be remiss of me to ask you, and you're not going to be able to do this justice in a few minutes, but I'll try anyway. You were also talking about something that you've launched recently, I think, the Health and Safety Regulatory Sandbox in conjunction with the HSE. Could you give us a kind of a whistle-stop tour of what that looks like?
Well, I shouldn't really claim any credit for this. I mean, this is very much something that's done by my HSE colleagues and so on. But basically, the effect of what it is in terms of the regulatory sandbox is to try out approaches, right? Slightly offline, right? And sort of do some experimentation. It's kind of a novel approach for a regulator. Think about it, right? Mm-hmm. And because if you are a regulator, then obviously, experimentation is not necessarily part of your day-to-day life. You try to provide stability, regulation, enforcing, and all that sort of stuff. So I really commend my colleagues at the HSC to sort of try to think about this sort of stuff, especially when you thinking about future trends, sort of the interaction between AI and work and so on, and what the role of a regulator will be in that space. So I really commend my colleagues at HSC for doing this. I think it's a very brave and worthwhile thing for them to do. But I think it speaks to something broader. I think it speaks to, some public sector organizations, in this case, the regulator, understanding how big a challenge some of these things are, and then trying to work through that and trying to find new approaches, novel approaches, and trying to work differently with employers, with interventions. And I think, coming back to the point I made at the outset of this of the podcast, is the point about how we work within a system and how the interplay works within a system. I think this is a really, really good example of how it could be different and how you could do these things differently. So more, please, I would say, more of these kind of approaches and creative thinking between regulators, employers, and their employees, or between other public sector bodies, because I think that's how we need to approach this.
Absolutely. I don't know which stage it's at, but have you got an example of like an experiment?
I would have to I would have to sort of refer you on to HSC and their slides. But clearly, I mean, different interventions and the sort of approaches between AI and safety, technology and safety. There's a range of things that they're looking at. Sound, like exposure to sort of sounds, and how technology could help you with that. Enhanced sort of, I don't know, wearing sort of glasses, safety glasses that enhance certain things and what have you. So all kinds of different things that they're trying out in this sandbox. Things that you probably wouldn't approve of at the outset, saying, hey, look, this is, you need to wear these glasses that Chris is wearing. But sort of working through that, so try to find an evidence base for it, try to allow for more experimentation within these spaces, so that we're not doing all the tried and tested stuff, but also try to sort of explore what technology can offer. So a lot of things going on there. But really worthwhile, as I said.
Great. Well, you've just given me my next guest for the podcast. I'll have to try and get a representative from HSC to tell us all about that. That would be great.
Yeah, you should talk to Helen, and I'm happy to put you in touch. Of course.
Yeah, absolutely. Sounds good. Right then. So I cannot believe it, but that's half an hour already. Absolutely whizzed by. I'm sure we could have spoken for much longer. I've got lots more questions. I'm sure you've got lots more to give, but I been fascinated by some of the things that we've covered today already. Thank you so much for your time today. The last thing I always ask guests on the podcast is, where can people find you? Where can they hear more from you? If you want people to find you, that is.
Look, very straightforward. Just Google my name. You can find me either through the RAND website. You can find me on LinkedIn. I'm happy to connect. Happy to exchange ideas. There's no monopoly on the truth. So I'm always interested to hear from people and see what they're doing and get new insights, new data sets. Everything is evolving so quickly in this world. So which also makes it so interesting to work in.
There's no monopoly on the truth. Great place to end. Amazing. Thank you again for your time today, and have a great day.